These 3 simple vitamins that every diabetic should take. You're doing everything right, yet your blood sugar keeps fluctuating. Every morning, the same routine. Blood glucose meter, breakfast, medication, walk. And then a sudden weakness, tingling in my fingers, irritability. The sugar levels keep fluctuating, and it feels like my body just isn't cooperating. You're trying your best, but an anxious question often creeps in. What am I missing? You might already be doing almost everything right, but you're missing one simple element. Or maybe even 3. Few people realize that certain vitamins can be just as important as medications. A deficiency in these vitamins can subtly exacerbate symptoms, hinder glucose control, and accelerate the development of complications, even when diet and lifestyle are strictly followed. These are not just empty words. Numerous studies confirm the impact of these substances on blood sugar levels, blood vessels, nerves, and even vision. What's particularly concerning is that these vitamins are often overlooked by both doctors and patients. But there's good news. You can start helping your body today. In this issue, we'll cover 3 simple, affordable vitamins that can truly enhance your diabetes management and protect your health. Watch until the end, and let us know in the comments. What supplements are you currently taking? You might not even realize which one you particularly need. Vitamin D, an unexpected hero for diabetics. Did you know that the common sunshine vitamin D is not just important for bone health, but also plays a crucial role in regulating blood sugar levels? Few people realize that most individuals over 50 with diabetes type 2 are deficient in certain nutrients, which may hinder their ability to keep blood sugar levels in check. If you're regularly taking medication and monitoring your diet, yet your blood sugar stubbornly continues to rise, you might be overlooking one of the most hidden causes. It turns out that vitamin D deficiency is one of the most common issues that creeps in with age and often goes unnoticed for years. Paradoxically, the older we get, the less efficiently our skin produces vitamin D, even when exposed to sunlight. If you live in the central regions and spend little time outdoors, a deficiency is almost inevitable. True self-care experts know that fatigue, weakness, and blood sugar spikes are often linked to low vitamin D levels. But what's truly surprising is that science gives no reason for doubt. Research shows that people with low levels of vitamin D have a significantly higher risk of developing type 2 diabetes and experiencing spikes in blood sugar. And vitamin D is a true shield against silent inflammation that wears down blood vessels, harms vision, and affects the kidneys. It's been proven. Vitamin D helps reduce inflammation and protects against complications. Imagine this. You get tested for vitamin D, incorporate it into your regular routine, and after a couple of months, you notice that your blood sugar levels are more stable, you have more energy for walks, your joints feel less achy, and your mood is more balanced. It's not a fairy tale, it's a modern approach to diabetes. Don't try to self-prescribe vitamin D. The optimal dosage should be determined with your doctor, taking into account your age and health condition. The first step is simple. Get a 25D test and discuss the results with your doctor. A heartfelt tip. Let vitamin D be your ally in the quest for stable blood sugar and robust health. Even a single analysis can be a game-changing step. What you didn't know about vitamin D: its deficiency can stealthily worsen the progression of diabetes. If you haven't had your tests done yet, you're missing out on a lot. Don't miss your chance to stay one step ahead of complications. The next vitamin you need is vitamin B1, your unseen protector. The second most important vitamin for diabetics, and the most underrated one. If you had known this 5 years ago, vitamin B1, thiamine, is not just a supplement, it's a true dispatcher of your health. Did you know that even with a proper diet, diabetics lose vitamin B1 at a much faster rate? Your body is like a big city, where glucose is the fuel and thiamine is the main dispatcher, without whom everything comes to a standstill. An unexpected fact: with diabetes, the kidneys start to actively eliminate thiamine. The longer you live with diabetes, the less of this vitamin is present in your body. This is one of those cases where healthy fatigue and tingling in the legs might not just be a sign of aging, but a direct signal. SOS? You're low on B1. Don't make the mistake that most people do. Don't ignore this symptom. A deficiency in thiamine is a direct path to complications. It affects the nerves and blood vessels, leading to numbness, weakness, and dizziness. Fact: a study published in Diabetes and Vascular Disease Research demonstrated that low levels of vitamin B1 are directly linked to the deterioration of blood vessels, eyes, and kidneys in diabetics. And now, here's some good news. How to boost your energy and reduce the risk of complications without complicated plans. Just maintain an adequate level of thiamine. You'll be surprised at how easily you can regain your energy, reduce tingling sensations, and even improve your mood. Doctors recommend paying attention to benfotiamine, a modern form of vitamin B1 that is particularly effective for older adults. If you are experiencing fatigue, tingling, or unusual sensations in your legs, discuss a vitamin B1 test with your doctor. Remember, this isn't just another pill. It's your investment in ease of movement and a clear mind. What you may not know? B1 support is your chance to avoid complications that creep up on every diabetic over the years. Don't let a deficiency steal your joy of an active life. But the most important vitamin is vitamin B12. What you didn't know about vitamin B12. This tiny nutrient can be your main protector against diabetic neuropathy and memory lapses. Tingling in your fingers, like a light electric shock, suddenly forgetting where you placed your glasses, and your mood constantly hovering around 0. Few people realize that these minor issues can be early warning signs of hidden B12 deficiency, especially for those taking metformin. Researchers have found that nearly 1 in 3 diabetics on metformin experiences a deficiency of this vitamin. This is no laughing matter. It turns out that without B12, our nervous system starts to act up like an old radio, occasionally picking up a signal and then losing it. This vitamin acts like insulation on nerve fibers. If there isn't enough of it, the fibers become exposed, significantly increasing the risk of neuropathy. Don't make this mistake with B12, or weakness, unsteady gait, and forgetfulness may become your constant companions. Did you know that B12 also protects your heart? It helps keep homocysteine levels in check, a substance that can damage blood vessels and increase the risk of heart attacks. And for diabetics, their blood vessels are already under strain. You'll be surprised at how easy it is to check your B12 levels. It's a standard blood test that is recommended for all diabetics over 50 in Europe and America. If a deficiency is found, there's no need to panic. Today, there are convenient tablets and capsules available, And for more serious deficiencies, there are injections. Everything is tailored individually, in collaboration with a doctor. What if you're already close to your goal, but just don't realize it? Even if you consume meat, fish, and eggs, metformin and age can hinder the absorption of vitamin B12. Don't let this stand in the way of your active future. Take care of your nerves and memory. Replenishing B12 is much easier than dealing with the consequences later. Don't miss your chance for a clear mind, confident stride, and strong health, even with diabetes. Don't make this mistake. Don't ignore the signals from your body. Your body can suffer from a lack of these 3 vitamins. Here's how to avoid complications. Vitamins D, B1, and B12 help keep blood sugar levels in check, and people with diabetes have an even greater need for them. True wellness enthusiasts are already discussing their test results and supplements with their doctors. If you're taking care of your health, this is for you. Don't hesitate to ask your doctor questions, inquire about vitamin tests, and discuss supplements. After all, who better than you can make your life with diabetes more active, longer, and filled with joy? May each of your days be filled with energy, clarity of mind, and peace of mind about tomorrow.